At Mathematica, we don't just generate evidence. We use it to shape the world around us. We make data accessible to those who need it, turning analytics into action. We harness the power of technology, helping evidence meet real-world needs. And we collaborate closely with communities, developing sustainable solutions for a more equitable and just world. That's the influence and impact of Mathematica. For the millions of people that use Medicaid long-term services and supports, getting access to the care they need where they want matters.
And we know that people would rather receive these services in their homes and communities rather than in an institution. But our healthcare system wasn't originally set up to meet that goal.
Over the last decade, our work on the Money Follows the Person program has helped over 107,000 Medicaid beneficiaries transition from long-term care institutions to home and community-based care. Recently, Mathematica worked with states to identify best practices to help with this transition. We also supported the development of reporting tools and a dashboard now used by staff from the Centers for Medicare and Medicaid Services to monitor state progress.
These best practices can be powerful for MFP grantees and those working within the long-term care community who are looking to improve their programs. The best practices were also recently shared in a report to Congress.
The impact is just beginning to be felt.
CMS is preparing to issue new final rules this spring that set a higher bar for ensuring people are receiving the long-term care services they need in a timely manner. Our report includes best practices that states have used and that other states can now employ to meet these higher standards.
That's an opportunity for lasting impact. Climate change poses a health risk, especially for the vulnerable populations served by Medicaid. Yet the healthcare sector is also one of the largest sources of greenhouse gas emissions, driving climate change.
Despite the opportunity to lead in this space, the resources really aren't there for state Medicaid agencies to get started in the right direction.
We partnered with the Commonwealth Fund to develop the first ever climate policy playbook for state Medicaid agencies, showcasing innovative strategies to leverage their purchasing power and regulatory authority to incentivize decarbonization in the healthcare sector.
The playbook helps state Medicaid directors understand the role they can play to lower greenhouse gas emissions and how to get started.
Since completing the project, state Medicaid agencies have reached out to us, seeking guidance on launching their own programs to incentivize decarbonization in their state's healthcare system.
Addressing today's complex challenges means the opportunity to shape the future in critical ways.
Climate change is the defining issue of our time, but we're just starting to figure out how to address it systemically and how to address its impacts on health. It's really exciting to be working on something at that intersection.
Despite almost universal access to primary and secondary education, antiquated teaching methods and poorly maintained schools contribute to students in the Republic of Georgia performing well below their peers. With economic growth significantly hindered, Georgia and the Millennium Challenge Corporation invested $138.6 million to improve STEM education.
Mathematica partnered with MCC to evaluate whether a $71 million investment to improve the quality of education by rehabilitating schools and providing STEM teachers with training in modern teaching practices and other professional development opportunities could improve student learning.
What did we find?
Students and teachers told us that the infrastructure upgrades substantially improved comfort and safety at school and addressed multiple barriers to classroom learning. Nearly 2 years later, almost all the teachers said that they were still able to apply the student-centered instructional practices they learned in training. And student learning outcomes showed signs of improvement 3 years after the program started.
Following this, the World Bank announced a new $400 million investment, its largest ever in Georgia, to continue strengthening human capital. MCC is also using lessons learned to improve education programs it is designing in Belize and Timor-Leste. Making data accessible sometimes means helping organizations increase their own capacity to use data. Through the Supporting Evaluation for Demonstrations and Self-Sufficiency Project, we partnered with the Administration for Children and Families to help grant recipients measure and communicate how they are helping improve the lives of families living on low income who have children. Through one-on-one coaching in culturally responsive and equitable evaluation practices, we helped 20 grantees take on data collection and analysis activities that empowered them to make data-driven decisions to improve services and ultimately outcomes for their participants. Our coaching helped grantees make seemingly small changes that are building the skills needed to adopt an evidence-driven culture. That has the potential to not only change these organizations, but can ultimately shape where the human services field is headed as well. Helping people get access to the care they need in the setting they want. Kickstarting new conversations about how the healthcare sector can combat climate change. Helping identify and address barriers to learning in Georgia and beyond. And working with grantees to build their own culture and capacity as data-driven organizations. That's how we're going beyond generating evidence to shape the world around us. That's the influence and impact of Mathematica.